talk to you about today will be the work I've done with Latinas, comparing Latinas to Latinas. But one of the things that's going to be coming out of this is, and it's actually right now being written, is a grant to look at why there are the persistent differences in the suicide attempts of young girls across ethnic groups, so that we can really find out what it is about Latinas that makes them different from African Americans, that makes them different from white girls who attempt suicide at high rates. So I'll give you a little bit of background here and present some of the research findings. And then, since we're pretty much practitioners and we're interested in how services can be provided that will help reduce the disparities, but also a suicide attempt of young girls, we'll talk about that toward the end. And I'll speak and then have a Q&A afterwards. And I'll try to go as fast as I can so we can have a good active interchange. Well, so when I was a much younger social worker back in New York City, working in clinics in East Harlem, the Lower East Side, the South Bronx, we began to see that young Latinas were coming to our clinics in large numbers. Now, no one was following the numbers. I was not a researcher at the time. I was just a clinician in the trenches. But we kept seeing these girls coming to our emergency rooms and in our outpatient health clinics, our outpatient mental health clinics, following a suicide attempt. So I would call clinicians in Brooklyn and Queens, and are you guys seeing the same thing? Yes, we are, we think. But again, nobody was keeping the numbers. And because suicide attempts are not the kind of thing that get marked up somewhere in public health sectors where we might have illnesses and deaths and recorded suicide attempts are not one of those. So, but we saw something happening, and so I went back to the literature, and the only paper I could find was one that was published in 1961 about Puerto Rican women in the South Bronx who had come to the attention of a psychiatrist there, Edgar Troutman, and he did the first study. It was so these were women in the late 1950s, because it was published in 61, so you figure it took him about 18 months at least to collect the data, and another 18 months to 2 years to get it published. So we're figuring that it was late 1950s. And he found that the suicide attempts were impulsive. They were often an ingestion of pills. They were often as a result of some stress in the family, usually between the woman and her mother or the woman and her spouse. Women didn't think of death. They weren't intending to die. In fact, they talked about having no awareness of the fact that they had tried or what was happening to them at the moment of this crisis. But when they got over it, they got over it very well. So they went, kind of back to normal functioning, if you will. And that was what happened in 1961, and at that point, the literature or the research goes silent until the 1980s. And so you see here, the research was way behind, despite the fact that we were seeing it. Only one paper was telling us something. Now, it's understandable that at that time, Troutman would find mostly Puerto Rican women. That was the largest Latino group in New York at the time. Later on, as the Dominican migration moved into New York, we began to see it there as well. And it was only in traveling around the country and reading different newspapers that I began to see that it was not something just a New York phenomenon, but I began to see it, hear about it rather, in Miami among Cuban youth and some Nicaraguan youth. And in the Southwest, Southern California, Bernardo Eng was finding that in his hospital, most of the people who were admitted in the psychiatric division were young Latinas, mostly Mexican, who had attempted suicide. So we were beginning now to build that in the 1980s. Then finally in the